Welcome to OIT Speaking. Today we can discuss an OIT role play. Here the setting is emergency room. You are talking to a 20-year-old female who started to feel unwell while playing outside. On assessment, you suspect heat exhaustion. Task: find out the reason for visit. Ask more details. Reassure her and tell about the importance of hospital stay. Explain about heat exhaustion causes seriousness. Educate her how to prevent further incidents. Here the setting is an emergency department and patient is unknown to you. So you can start your conversation by saying, "Good morning, my name is Sarah. I am a registered nurse on duty today." You can ask what happened. Or you can ask, "I can see that you are quite upset. What happened to you?" Probably at that time, patient may tell you like, "Sister, when I was playing outside with my friends, I felt unwell, so I came here with my friends." Then we need to reassure the patient. Here, as per our first task, we inquired about the reason of visit. So now we need to reassure the patient, so you can tell her like, "Oh, I'm really sorry to hear that. Don't worry, you are at the right place. I can help you out." After that, you can ask the name of patient. So you can ask her like, "Before proceeding further, may I know your name for my documentation?" Here, let's assume the name is Miss Maria. Then we can ask about more details as per our second task. For that, we need to ask permission from the patient. So you can tell her like, "Mrs. Maria, is that okay if I ask some questions to get better understanding of your condition? Is that okay if I ask you some questions to get a better understanding of your condition?" Then you can ask some questions like, "Could you tell me more about your problem?" Only at that time, patient may explain like, "Sister, I was playing in a ground with my friends. It was so hot outside. Suddenly I felt dizziness, nausea and fast breathing." Then you can ask question like, "Do you have any ongoing medical problems? Are you on any medication?" These questions you can ask one by one. You can ask, "Could you tell me more about your problem?" Then second you can ask, "Do you have any ongoing medical problems?" Then third you can ask, "Are you on any medication?" Probably she may reply as per the interlocutor's card. Then one more question you can ask like, "Did you take adequate rest and water during playing?" Did you take adequate rest or water while playing? After that, you can tell her like, "Thank you for answering my question. Thank you for answering my questions. It helped me to understand the situation much better." And as per our third task, we need to tell the patient about the importance of hospital stay. On assessment, we suspect patient has heat exhaustion. We can tell her like, "From your explanation, I suspect heat exhaustion. This might have been happened because you played in the extreme heat and you didn't take adequate rest while playing, or you didn't take adequate precautions while playing." So you can tell her like, "From your explanation, I suspect heat exhaustion. This might have been happened because you played in extreme heat and you didn't take adequate precautions or rest." Sometimes the patient doesn't agree with you. If the patient does not agree with you, then you can tell her like, then you can reassure her by saying, "Mrs. Maria, I understand your concern. See, Miss Maria, it's quite normal to have these symptoms for a little time after heat exhaustion. The doctor will come and see you soon. The doctor will confirm the diagnosis. Soon after that, we will begin the treatment if needed. Probably you would need intravenous fluid to hydrate your body. Is that okay?" "I completely understand your concerns, Miss Maria, and it's quite normal to have these symptoms for a little time after heat exhaustion. But you don't worry, you will be all right after taking appropriate treatment. The doctor will come and see you soon and will confirm the diagnosis. After that, we will initiate the treatment if needed." And as per our third task, we need to tell the patient about the importance of hospital stay. So you can tell her like, probably you would need intravenous fluids to hydrate your body. So it is Very important to stay in the hospital. Sometimes the patient may not agree with you. She may tell you like, sister, I would like to go home. Then we can tell her like, Miss Maria, I am so sorry to tell you that it's not a good idea to go home now without taking any treatment. I would like to tell you that your condition needs proper examination by the doctor to confirm the exact diagnosis and proper management. It's not safe to go back to home as you are not well. So I strongly recommend you to stay in the hospital to get the appropriate management. Are you okay with my suggestion? The patient is okay. You can tell her, I am glad to hear that. Then as per our fourth task, we need to explain about heat exhaustion and it causes seriousness of this condition. So you can tell her like, Miss Maria, I would like to provide some information regarding heat exhaustion and some suggestion to prevent further occurrence. Is that okay? After getting permission from the patient, you can explain like, heat exhaustion is a common condition which occurs when our body is exposed to extreme temperature and sometimes it may lead to serious complications. Therefore, we need to aware about the symptoms and also you need to take some precautions while playing outside at extreme hot condition. The main cause of heat exhaustion is exposing our body to heat and lack of hydration along with strenuous activity. Now, I will tell you some precaution which you need to take for the prevention of similar occurrence in the future. Then you can tell her like, Miss Maria, while playing outside in hot days, you can wear lightweight and loose-fitting clothes. It's always better to apply sun protection cream and drink plenty of water to maintain proper hydration. Also, it is very necessary to take frequent breaks and resting to cool your body. Are you getting me? So you can tell her like, Miss Maria, while playing outside in hot days, you can wear lightweight and loose-fitting clothes. It's always better to apply sun protection cream. Drink plenty of water to maintain your hydration. Also, it is very necessary to take frequent break and resting to cool your body. Are you getting me? Now our task finished, so you can ask her, do you have anything to share with me? Do you have anything else to share with me? There is nothing. You can wind up by saying, okay, Miss Maria, please take rest. The doctor will come visit you soon. Meanwhile, if you need any help, just press the buzzer which is at the right hand side of your bed. Thank you, Miss Maria. Get well soon. In this way, you can end up your role play.